Morning, YouTubers. I know, I promised the commode video, but not gonna happen today. I want to talk about differential diagnosis and the fact that you can't always get to the diagnosis that's correct for you. That is what's going on with you. My injury, and I say injury, is because in 2000 I switched careers. I went from being a paramedic to an operating engineer running heavy machinery. For me, it was a much more physical change because the first 4 years you're an apprentice with the operators. Lots of climbing and physical activity, even above and beyond what I did as a medic. So by 2001, I had manifested with right-sided hand weakness, right arm, neck pain. I was in agony. It actually took me out of work completely for about 8 months. And I was seen locally. At first, thought it was a pinched nerve, treated that, it didn't work. And we got the MRI, and it showed my neck trauma. So I went to various facilities. IU in Indy, was seen by a neurosurgeon, and then on to Mayo Clinic in Rochester, was seen by the team up there, and I elected not to have surgery. It was an option provided to me. Rest, medicate, heal, and see where you're at. I did well. I healed up enough to go back to work. I did lose some strength in my arm, right arm, but I had vertigo since 2001. Not not intolerable, but close. Nausea from the vertigo, and there was days I just had to pick and choose what I did. So I functioned that way till about 2015, 2016, and I recognized more was going on. So I pursued the doctors to do more testing, and some were compliant, some were not so much. And what I mean by that in differential diagnosis is I knew there was more going on with me. I know me very well, as you probably know you very well. I would have the occasional word I could not articulate, and it slowly changed into the bulbar dysarthria speech and activity I have now. Hypersalivation, forcing to talk, all that has changed dramatically in the last 15, 16 months. Prior to that, I was looked at by people and they're like, we don't see we don't hear the speech trouble because they didn't know my voice, cadence on my talk before. I really search for words uh, that I can articulate as opposed to words that feel like they're going to come out funny. And so I focus as best I can to speak clearly, slow down, get enough air to speak. And right now it's early in the morning. I'm good. I'm articulate, I think. And Bulbar goes along with the ALS factor that fatigue sets in. And the more I talk, the fainter it gets, the more tachypnic I get, the lower air hunger. Biax well even talking, but it does take a toll on you. It's fatiguing. So anyway, I was looked at multiple times. My path was neurosurgeon type path initially because of my neck trauma. So a lot of focus was driven on that. Now, when I started having the trouble, occasional word articulation, I thought maybe since I injured my neck as bad as I did, and again, we can't point the finger on one incident where my neck trauma was generated from. I've been concussed in my life more than a couple times. So my thought pattern as an old paramedic was if I hurt my neck that bad, I probably rattled the brain equally. And my neurosurgeon agreed that I should get further looked at. And my brain MRIs with and without contrast, I say showed nothing, but it showed normality in my brain. But if you look at concussion research, they're not finding these things in these people till they are deceased and they pull the brain and look at it from the bottom. So they're getting better at it, but most of all, you have to go by symptoms and career and concussive nature. However, the first neurologist I went to, he wrote me off as crazy. He thought I needed more psych testing for some reason. I have no psych history, and my wife was with me at the appointment, and she was very upset that he didn't believe me, but he heard a patient that spoke fairly clear and was just having the occasional, hiccup with a word. But later, I spoke with my family doctor a year later, and she knows the change in my voice and how I was pronouncing things. So At that point, I had pretty much given up, and that's what I don't want you to do. I don't want you to give up. Look for the doctor that will believe you and listen to you and apply the testing that's appropriate to move forward. I have been MRI'd with and without contrast, neck and head, at least a dozen times. So I'm experienced laying in the tube, and it netted me zero. So, um, what continuing doing the same thing isn't cutting it. So my family doctor referred me to a new neurologist in the area, and we had an appointment started at 8 in the morning. We didn't leave there till they closed the office at 5. He would not allow me to leave. Within the first 10 minutes of the appointment, he listened to history, my vitals, and of course, my presentation. And he said, John, I believe you have motor neuron disease, ALS, Lou Gehrig's, what type specifically. He said, we need to test you. So that's what they did. They signed me up for an EMG right then and there. By 1 o'clock in the afternoon, I had my blood work done that was sent off to a specialty lab, and then I had my EMG done. And I don't want people to be afraid of EMGs, but they're not the most pleasant test. So if you, like me, have a pretty high degree of pain tolerance, it was fine. I was fine. I jokingly said "ow" at one point, and that was after I'd been stuck with a needle probably 20 times at that point. And he chuckled and I chuckled because, it was okay. And the reason for it is we're trying to get the answer we need. So don't give up. Don't surrender till you get the right doctor. And at the end of the appointment with my new neurologist, he was able to diagnose me, and he sent me to a larger clinic setting to get confirmation. And we got that without testing at the larger tertiary care center. They essentially looked at his results and looked at me and confirmed my ALS diagnosis. Now, if you have a list of neurological diseases, this isn't the one you pick. But nevertheless, I personally feel vindicated because I knew there was more going on. And that's my point to you. Don't give up. Keep allowing some testing. Help manage your care, your diagnosis. Get to where you know what really is going on. So, with that, I'm going to close out. I'm getting long here. So please like, share, and subscribe as you see fit. And we're going to get back to more of the equipment investigation for what I use for my ALS path journey. So we'll see you soon.